Dr. Helene. I'm the founder of Mama Bear PT, a virtual pregnancy and postpartum support practice. You may have heard that deep breathing has a lot of benefits, but one you may not have heard about is that it's great for pelvic floor health. Not only does deep breathing decrease stress and anxiety, which can benefit the pelvic floor because a lot of us actually take our stress into the pelvic floor, but there are some mechanical benefits of taking deep diaphragmatic breaths. Diaphragmatic breathing is a specific type of deep breathing where we really focus on using the diaphragm to take a deep breath. Interestingly, a lot of us breathe using our chest or our stomachs, more often than not our chest if we sit a lot of the day, and we use what are called accessory muscles to breathe. So our diaphragm doesn't move a whole lot. Intentionally breathing with the diaphragm helps the pelvic floor move through a full range of motion. Every time we use the diaphragm to breathe and we inhale, the diaphragm contracts and descends to make space for the air in the chest cavity. At the same time, the pelvic floor mirrors that motion and lengthens and descends in the pelvis. This way, the contents of our abdomen have some space even as the diaphragm has descended. And then as we exhale and the diaphragm returns to its dome shape in the bottom of the ribs, the pelvic floor shortens and ascends in the pelvis. By intentionally doing this and moving that pelvic floor through a full range of motion, we can help the pelvic floor be better able to both relax and contract so that it can act the way it's supposed to act, which is supple, like a trampoline. The benefits of a strong, healthy, supple pelvic floor are preventing things like urinary incontinence and pelvic organ prolapse, decreasing pelvic floor pain or any pain in the surrounding area, including the lower back and hips, and also improved sexual function, where you may experience orgasms more readily and more intensely. I'm going to lead you through some diaphragmatic breathing so that you can add this to your daily practice to keep the pelvic floor healthy, strong, and supple. I want you to start by finding a comfortable seat, maybe on the floor, maybe a couch, chair, or a bed. Sit with the feet firmly planted on the floor or the legs crossed, however you're comfortable. Let the hands rest on the thighs or by your side. We're going to focus on taking inhales that fill the rib cage circumferentially. So we want all 360 degrees of the rib cage to increase in size as you inhale and then release as you exhale. Ideally, the chest will stay soft and the stomach will stay relatively the same size. So rest those hands, gently close the eyes, and then without judgment, take a nice full inhale and exhale, let all of that air go. This time as you inhale, I want you to see if you can feel the circumference of those ribs increase. And exhale. Inhale, feel the ribs broaden side to side and front to back. Exhale, let all of that air go. Continue to take these deep breaths. Notice if there's an area that is more difficult to expand as you inhale. For most folks, this will be the back bottom of your ribs. So really focus on that area, maybe. Whichever area you found was challenging for you for the next few inhales. Make sure you're releasing all the air in between each breath. Gently let that breathing return to normal. Keep the eyes closed and notice how you feel. Maybe you feel a little calmer than before you did this deep breathing. Maybe your chest feels a little softer, better able to relax. You might find that you feel a little taller because the spine is stacked a little better than it was. Gently let the eyes open. Wonderful job on the deep breathing. Thank you for trying that with me. Taking 10 breaths like this every day is a really wonderful way to keep your pelvic floor healthy. These are awesome. Even when you're pregnant, it might be more challenging because the diaphragm actually changes shapes while you're pregnant and it flattens and moves up a little bit. It's also really nice postpartum as a way to get the abs and the pelvic floor gently moving again. I'm so glad that you tried this deep breathing with me. It has so many benefits, especially for pelvic health. And we at Mama Bear PT are all about keeping mom happy, strong, and healthy. If you are having any symptoms of pelvic floor dysfunction, such as discomfort with sex, difficulty fully emptying your bladder, pain at the vagina or in the surrounding areas, then we can help. You can find us at mamabearpt.com, on Instagram at mamabear_pt, and you can reach me at Helene, Helene, at mamabearpt.com. We also have an expert lactation practitioner, Disa, who's amazing, and Erica is our resident doula and nutritionist who offers childbirth education, nutrition, and pregnancy and postpartum coaching. I know that these folks are the best team imaginable because they were my team when I was giving birth. Disa helped me figure out how to breastfeed my son, and Erica was my childbirth educator and doula. So I cannot recommend them highly enough. And we love to help moms. So add this deep breathing practice to your daily routine. Let me know how it goes and reach out if we can help you with anything else. Thanks so much.